Continues right now on News Channel 8. The day's top local stories plus up-to-the-minute weather. News Channel 8, non-stop local news.
March is Colon Cancer Awareness Month. A recent study published in the Journal of the National Cancer Institute found an alarming rise in the number of colon and rectal cancers among young adults, despite rates declining for older Americans. We're here to tell us about the warning signs and some prevention tips for colon and rectal cancer. Dr. Mohamed Salem, he's a GI oncologist at MedStar, Georgetown University Hospital, and cancer survivor Julius Grant. Gentlemen, good to have you both in here this morning on Good Morning Washington. Thanks for joining us. Doctor, I want to start with you. Tell us a little bit about this study, and these are some alarming numbers that came out of this.
Yeah, so thank you, Larry, for having us today. As you said, most people have colon cancer when they are around the age of 70. However, the recent study just came out this month showed actually, despite the incidence of colon cancer is declining in older people, younger population, mainly millennials, actually the risk is rising.
Why is that younger people are now seeing more of this? Yeah. You were saying someone as young as 17 years old, you've had a patient diagnosed with this?
Yeah, one of my patients actually was 17 years old. As I mentioned last week, I saw a patient 20 years old. So this is happening. And in fact, the study showed people who were born in 1990 have twice the risk of colon cancer and 4 times the risk of rectal cancer compared to people who were born in 1950.
Why is that?
So this is a million-dollar question. Nobody really knows for sure why this is happening, but there is risk factors such as obesity. That's something we think has a big role on it. Smoking, alcohol, lack of exercise, red meat, and high-fat diet. All those we think are risk factors. But we really think there's something else also going on causing that, because if you think about it, older people also do the same thing. But I think that's something we have been noticing lately, and I think I'm glad the study came out to just shed the light on such an important topic.
Absolutely. Julius, tell us about your experience. You were 43 when you were diagnosed, correct?
Yeah, that's right. Yeah, 43, diagnosed, just came out of nowhere. Ate healthy, minimal exercise, and got the diagnosis.
Wow. He just talked about some risk factors. Did some of those things apply to you?
I can't think of anything. They checked the family genetic marker, so it's not something that's, known to be existent in my family. I really can't say for certain how it happened.
Okay, and so that was in 2013?
That's correct.
Okay, and you are still in treatment now?
I'm currently in treatment at Georgetown Medical Hospital.
Okay, awesome. We've got a full screen here with some risk factors that you both mentioned. Older age, African Americans also at risk. As you mentioned, polyps. I told you, doctor, I had an aunt years ago that there was a polyp found in her colon in 1980. She never got it checked. And 9 years later, it was way too late. And unfortunately, she passed away less than a year later. Obesity, smoking, alcohol, you mentioned as well. I want to get to, we have a full screen as well with some symptoms, and I'd like you both to kind of talk about this in terms of some things. Julius, tell us, what were you experiencing that led you to go to the doctor?
Well, for me, I had problems digesting food. My food intake, every time I try to eat something, after about a day or so, food would just, kind of regurgitated up. So after a while, I went to a GI did some tests, and that's when he saw the cancer as a tumor on my colon. And so he recommended that I do not wait, go and get treated right away, and so I jumped right on it. And I can't say enough about early detection, but also paying attention to the doctor's instructions as well.
Okay, doctor, your thoughts on this, as well as he was saying some things change in bowel habits and unexplained loss of weight. Yeah.
Sure. Yeah. So the good news anyway is 85% of colon cancer patients actually have symptoms. So majority of patients will have some kind of symptoms.
Okay.
The problem, as we were talking before, that when you are young, when you're 3 or 4 years old, You don't think you're having the symptoms because you have cancer. You think you are tired or stressed or something going on. Red flag is like bleeding. If you have bleeding, weight loss, unexplained weight loss is also alarming. Change in bowel habit, abdominal pain, or as Mr. Grant said, like problem with digestion. So I think if you have any of those symptoms, you should seek a medical advice.
Okay, we've got about 30 seconds left. Some prevention strategies and some treatment options as well for people who may have colon cancer.
Healthy lifestyle, exercise, high fiber diet, no smoking, moderation in alcohol consumption. Okay. We also think sometimes aspirin help.
Okay. And we can learn more about at cancer.org and potential treatment options. You said, again, 85% of the time there are treatments there. Once you do get diagnosed, what is the survival rate of this kind of cancer?
So it depends on what stage.
Okay.
And the key, if the colon cancer get caught early on, actually people do very well. 90% of patients do okay. But the key is just early detection and catch it early.
Okay. Dr. Salem, good to see you. Julius, thanks again, and we wish you the best. Pray for you and your recovery as well. And again, cancer.org is where you can go to find more information about this. Thanks again, gentlemen. Appreciate it. 8:40.